Welcome to Early Intervention Matters, the podcast that helps parents, teachers, and health professionals understand the diagnosis, treatment, care, and support of children with autism, ADHD, Tourette's, and other neurodevelopmental challenges. Your host, Dr. Inyang Takon, is a consultant neurodevelopment pediatrician, and she will provide insight through interviews, answering questions, and breaking down complicated topics. By sharing stories from parents and professionals in the field, we hope to make sense of what can be an overwhelming topic. Early intervention is crucial with children with developmental difficulties. Yes, early intervention matters. And now, here's your host, Dr. Inyang Takon.
Hello, everyone. You're welcome to this episode of the Intervention Matters podcast. Welcome back to this platform where we share information, we discuss the interface between science, neurodiversity, and practical solutions. What we talk about is very useful for families, parents of children with neurodiversity, for educators, and anyone supporting a child or young person with neurodiversity. I'm very pleased today to have Dr. Norrine Russell, who is going to be sharing some very useful information. I'll just want to welcome Dr. Russell first. Thank you, Norrine. Thank you for joining us. Thank you for accepting our invite to connect.
I'm thrilled to be here. My early work in my career was all about prevention and early intervention, and I really feel that this area needs so much more focus when it comes to neurodiversity, the early intervention piece. And so I'm thrilled to be here and have today's conversation with you.
Thank you. Thank you so much. As a clinician, I see lots of young people, children who come in, young people. And I always say to my colleagues, the nice part is giving the diagnosis, but then what happens after that? Because they've got a life ahead of them, and these young people have to navigate life. And I feel, we need to be giving very practical solutions to help support them. And so I'm really pleased. And having read about your work and seeing what you're doing, I felt that, yes, it was a great episode to have. Thank you. And we all know about the typical child where, families keep wondering. They hear this all the time, possibly going for school feedback evenings, what we call parents' consultation here, parents' evening. And they're told time and time again, your child is bright, the teacher knows it, parents know it, but somehow things don't get done, homework doesn't get done. Morning is a battleground, somewhere between the capable and collapsing. You stop recognizing the child in front of your parents are frustrated. They've got this battle to get on with the day, but they also have the battle of getting their child ready and getting the day. So we're really pleased that Dr. Russell has spent decades sitting with families, navigating this process. She's the founder of the largest student coaching practice in the United States, and she does understand this process, and she's going to help us talk through it. So, Dr. Russell, if you could introduce yourself and tell our audience a bit more about you, a bit more about your work. So, okay.
Yes. So I am the founder and the director of Russell Coaching for Students, and it is the largest student coaching practice in the United States, focusing on neurodiverse children and teens. And I have been doing this work for about 17 years. I have a PhD in psychology. Now, I am not a clinician and I am not a therapist. My background is in positive youth development, positive psychology, strengths, resiliency, everything that kids need in order to grow up into healthy adults. So I spent the first part of my career doing academia. Then I had a second career where I was doing applied work, nonprofit work. And then I had my son. And I think some of your listeners will relate to this story. He was complicated. And I found that a traditional job was not really a good fit with needing to be available for school meetings, doctor meetings, therapy meetings. And so it was about 17 years ago that I resigned from this job that I loved very much. And I had no idea what I was going to be doing, but I got a lot of referrals from the licensed clinical psychologist in town who said, "Can you work with this student? They don't really need therapy, but they need coaching and mentoring." So I said yes because they were my friends and colleagues, and had no idea that 17 years later that would grow into the largest student coaching practice in the country. We've developed our methodology, connected coaching, and we see kids primarily in the United States, but about 5 to 10% of our population is international. So
That's an amazing journey. How one thing leads to another, but it's just amazing, isn't it? That your career pivoted in another direction, but it's been a great direction, and you're doing work that's so useful and meaningful for a lot of families. Because this is usually the crunch point for lots of families that we see. So thank you so much. Now I'm just going in from a coaching. You work primarily with older students. What age are the children or the young people you work with?
we generally start at about age 8 or 9. In the
Okay.
United States, that corresponds to third grade, which is a big jump up from second grade. So I know you have a lot of international listeners. I'm not sure how that corresponds to their education systems, but at 8 or 9, generally, the reason why school becomes more demanding is that a student is expected to be able to read fluently and to have their math facts down. And sometimes, when those things haven't happened, there can be, some questioning of, what's going on. So we start at age 8 or 9, and we work with students through upper elementary, through what here in the States is called middle school and high school, and then through college. We generally work with people up to about age 25 or so. Now, sometimes by the time they get to that age, sometimes they're in college, sometimes they're not in college, sometimes they have a job, sometimes they don't have a job. But because my background is in developmental psychology, I think it's really important that we start as soon as possible with teaching some of these skills that kids who have ADHD or autism don't necessarily come by intuitively. So yes, we start early, and then, follow all the way through to young adulthood.
That's great. I know your focus is more on coaching because you said that at the beginning. For the purpose of our audience, because sometimes people don't, can't really differentiate what coaching and therapy is. So I'll be grateful if you can, just expand a bit on that for our audience.
Yeah, they really are two different things. And so while there is overlap in the way any individual person practices, there could be, similar outcomes. But in general, we think of therapy as being designed to treat and hopefully reduce the symptoms of some kind of diagnosis, anxiety, depression, bipolar. Therapy is meant to be treatment for a mental health diagnosis. Now, of course, we could get into the nitty gritty of that. We could say therapy can also be supportive and things like that. But what coaches do, their role, their lane is to focus on skills and strategies. So helping the child with ADHD or autism to build new skills, life skills, daily skills that they need. And interestingly, therapists are not really trained in coaching, in that kind of practical daily, okay, we need to get out the door in the next 20 minutes. What do we do? And so there is very much a need for both therapists and for coaches. But I'm very honest and direct about this. The coaching profession needs to get to a point where it is licensed and regulated, because it's not currently in the way that medical practitioners are, in the way that therapists are. And so anybody can be a coach. And I think that's an important thing for your listeners to understand, and maybe part of why they see so many options for coaching out there. Because I've seen, lately friendship coaches, marriage coaches, in addition to, job coaches. But the piece of this that's so valuable with our neurodivergent children is that we really know that their executive functioning can be about 30% delayed. And
Right.
so coaching can help to build those executive functioning skills so the child is less at odds with what the developmental expectations are at school.
Thank you so much. Thank you, Norrine. That's so helpful because as you were speaking, I was thinking to myself, almost every child I see in clinic needs a coach because it's almost something that you want to say after a diagnosis. The next thing is that they should be assigned a coach to work through that process.
Very interesting. The United States medical bodies, like the American Academy of Pediatrics, therapy is not first line treatment for ADHD. Medication, school plan, and parent education is. And so it's very interesting. We have not come together as a field
Hmm.
to be pushing the same message.
Yeah.
We need to have a science-based, evidence-based treatment program. And
Mm.
where coaching comes in is in the skill building, not doing therapy, right? But in the skill building. So there is definitely a place for ADHD coaching in terms of education, advocacy, and skill building.
Yeah, I completely agree with you because I know we started off talking about the fact that you work with helping children with their executive function challenges, and that's the key thing. That's the crux of the matter with a lot of the young people with ADHD, ASD. Is this is where they're falling apart, and this is where a lot of the frustrations, a lot of the conflicts. This is what comes in. And yes, we can treat with medications, we can do that. But I always say to families, it doesn't resolve that problem. So, medication treatment, yes, it would reduce some of the other symptoms, but because they come back saying, oh, but he's still this, he's still poorly he's still this, and Dr. Takon, and I say to them, no, I'm not going to increase the medication because this part of the challenges are not going to be resolved by medication treatment. And that's why, I'm saying almost every child should be having some access to coaching to help with their skills. And knowing for the purpose of our audience, if you could please explain what we mean by executive functioning so they can follow as we're talking.
Yes. So this is so important to understand, but it is not complicated. We came up with this term, 10 or 20 years ago, executive functioning skills. And it doesn't intuitively explain itself, right? But for the sake of your listeners, think of the person who is the executive of a company. If they're the CEO of the company, they are responsible for the big picture. They're responsible for planning, for prioritizing, for making sure people follow through on things. They're responsible for hitting goals, for time management, for looking at what's going on and examining it, right? The CEO of the company is directing everything. Well, so the reason why we took this particular set of life skills and called it executive functioning skills is it's the set of skills that allows us to be the executive of our own life. So things like working memory, impulse control, time management, planning, prioritization, all of those things are things that we need that are not school skills. They're not content information about history or math, but you still need this set of self-regulation skills. Personally, I like the word self-regulation skills. I think it is
Mm.
accessible and more intuitive, but that's not the direction that we've gone right now. It's executive functioning skills. And so every single one of us needs to have these executive functioning skills. What we need to understand about kids who are neurodiverse and adults who are neurodiverse is that the development of these skills can be delayed or can be, in the case of a child who has both ADHD and autism, can be in conflict with each other. And so this is where coaching, good coaching based on the neuroscience of ADHD can come into play to teach a student these skills. So I love that you brought up medication, right? We all know two things. If you're the parent of a kid with ADHD, you've heard this: pills and skills, and pills don't teach skills. And so, yes, you can get that core attention regulated with medication, but that child is not going to know anything more about how to manage time or organize their backpack.
Yeah.
It's two separate things, pills and skills.
Yes, definitely. And I think that message needs to go out more, because I think the people feel the minute the child's got an ADHD diagnosis, the next thing is, the treatment with medication, and that solves everything. So it is beyond that. It goes way beyond that. Now, in terms of early identification, we don't see children until they're at least 5 or 6 before they have an assessment according to the guidelines. So we don't see them much younger. But for some parents, they would wait and think, okay, she's just going to get a bit more mature. We'll just wait for them to grow out of it. They'll get better as they get older, and they start seeing the things not really getting better. At what age would you say parents should begin to take action and not really continue the wait and see approach? When would you say parents should be worried?
At my practice at Russell Coaching, we just try to stay consistent with the American Academy of Pediatrics recommendations for the identification and treatment. We're not medical practitioners, but we feel as part of the child's team, we want to be on board with what does the science say. And the American Academy of Pediatrics takes a very proactive stance. If the child is struggling in school, if the child is struggling at home, if anyone has a reason to be concerned, then do the evaluation. I wish we would start thinking of an ADHD evaluation the same way we do for physical injuries. Your child got injured on the sports field. We need to go, get tested to see, is there a concussion or is there a broken bone? The answer could be yes. The answer could be no. It doesn't change the reality, right? Like, the concussion or the broken bone is there regardless of whether you go. The ADHD is there or not there. What we miss out on when we don't go early for that early identification, is that child can struggle in school during some very formative years. When a child does not learn to read in the early part of elementary school, it really pushes the rest of their school back into a disadvantaged place. And so whenever I speak with parents of younger kids and they're wondering and they're saying things like, well, I don't know, he's a boy, she's a summer birthday, I was just like that. That's what I hear a lot of the time. I was just like that. I always very gently, with love and kindness, say, it's a question. It's a question that we should get answered. And the answer might be yes, there's ADHD. And the answer might be no, there's not ADHD. But it would be so much better to know if there is ADHD so that we can start early intervention because we've done early identification. And so I think it's very easy for parents to think it's just that teacher, it's just that school. I mean, I've run into parents, of course, along the way who have changed schools, changed placement. But ultimately, what helped was identification and treatment.
Yes, I agree with you. And I'm quite happy that you have these conversations with the families. What's usually their response? Are they receptive to it?
Yes, I think they are, because many times what happens, especially with the younger ones, is, and I was like this when my kids were this age, that my kids are teenagers now, but I expected school to be the authority and the leader, right? And I sort of felt like, well, if school wasn't telling me there was a problem, there was no problem. And the reality is that as parents, we are the advocates. As parents, we are the ones who are responsible for that child ultimately. And so I think parents that I speak with are often relieved to hear someone say, you know what, let's just go talk to a professional, have them do an evaluation. Here are the different kinds of professionals who do those evaluations. This is what you're likely to learn. And I think they're very relieved to feel heard, that they're not crazy. You know, I spoke to a mom this morning. She's like, everyone just says my daughter doesn't care. She says, you know, the teachers say she doesn't care. Her father says she doesn't care, but I think she really does care. And I said, this is where doing the evaluation will help you to better understand your daughter and then help you advocate for what she needs at school. And so I think parents mostly are very relieved to have that conversation. Many parents are terrified of ADHD medication, but that's a follow-up conversation, right? That's a follow-up conversation. So I usually leave it at, let's go talk to a professional. Let's see what we need to learn. And I think parents feel validated.
Yeah, so Norrine, one of the things that does happen is in the UK, once when a child is diagnosed, we have first line behavioral management, and then we see the child again, and if things haven't gotten better, we then introduce medication, except if they're severe at the onset, then we decide on medication treatment. But one of the difficulties is that this behavioral management or behavioral therapy or behavioral approach is a non-uniform approach because it all depends on where the child is. And mainly it's parent training. It's being making parents more aware about what ADHD is and knowing how to support their child. But it's not taking each child's needs into consideration. It's not looking into that child's specific needs. It's not something that's tailored to the child. It's just a generic parent training. And I see the difficulties that happens because I always feel this is not enough. You know, you've got a child who's got their unique needs. You know, how do we navigate that process and help that child through that process? And it's very difficult when the families come back and say things are still the same and all that. Then you go on medication treatment. The schools are not really having that information or skills to help support the child through that because again they've been given generic information about what to do for the child in terms of school adjustments and reasonable adjustments. So I do agree with you that we are not cohesive in the way that we approach supporting children who've had a diagnosis, who many of them, the executive function is a huge part. And I love what you use about self regulation. That is a very huge part of what we continue to see. That's a huge part of where the conflict lies with the child, what the child struggles at home. I don't know whether in the United States things are different, but I listening to you today, I just keep thinking, gosh, we do need a different approach into how we support children with ADHD. I don't know what your take is in terms of what happens in the States.
No, we absolutely need a whole different system. First of all, I think one of the confusing things is that as a parent, you ask other parents, where should I get my kid evaluated? I think they have ADHD. You can go to the pediatrician, you can go to a neurologist, you can go to a psychiatrist, you can go to a psychologist. Parents don't live in that world. I mean, unless they happen to, but most parents don't. And so they don't know what are the relative merits of which type of professional are you going to, right? The pediatrician is going to do a medical evaluation. The psychiatrist is going to look at the medical evaluation, but also take a look at things that could be comorbid. The psychologist is also going to look at things that could be comorbid, but also take a look at the education side of things. And as a parent, you're just lost. I mean, if you think your kid has a broken leg, you're not the one who figures out which doctor to do, right? No, go to the emergency room. We need to get the x-ray. The x-ray technician's going to do it. And then, the bone doctor's going to decide. You don't have to educate yourself about how to take your kid through getting an x-ray and a cast for a broken bone. But you do with ADHD. You have to know. So I think there needs to be, first and foremost, a lot more cross-disciplinary connection and communication. We need to come together, everyone, medical professionals, education professionals, mental health professionals, and coaches need to be at the table and say, what do we know? What is science-based? What should every family who's leaving with a diagnosis know, right? And it wouldn't be that hard. And there are organizations that could take the lead on that. But what families need to know is that there is a logarithm, there is a treatment that should get followed, like you're saying. In the United States, under 6, behavioral therapy is first. At age 6, medication becomes first line, with behavior therapy, parent education, and a school plan close second. I think that also we need to more consciously be willing to debunk the myth that medication is dangerous and that medication should be the last thing you do, right?
Mm.
Because what medication does, and you speak to this, it's your area, but it's help with the impulse control and the attention regulation. Those skills so much that we can teach. We can teach time management. We can teach planning. We can teach prioritization. But if a child is so impulsive that they can't sit in their seat, or their brain is just wandering and distracted all the time, that's why pills plus skills. And pills often set the stage for the skills to take. And so, I think there's a lot of work yet to be done coordinating different fields when it comes to ADHD.
Yeah.
Because ultimately, when a child doesn't get identified and they don't get treatment, they end up not feeling great about themselves. And we know what the outcomes of untreated ADHD are. They're not good.
Yes, they're not good. And the thing is, a lot of them actually, here, what tends to happen a lot is so many of the children, because of their executive function challenges, some of them don't even get to finish school. They are excluded sometimes, they drop out of school, and which makes things worse. There's conflicts going on. Some of them end up leaving school before they even complete it, which makes it even more difficult to get them back reintegrated. And again, this is the fragmentation that takes place because they come to you in the clinic and you're having a conversation with the families, but you were not able to connect the other people that they need. I can tell you, most of my patients don't have a coach. They don't have access to a coach. They don't have somebody working with them to navigate this. So it's, like you said, families troubleshooting. Where does my child in mental health? Sometimes, many times, not even sometimes, we refer to the mental health services and they say, no, the child doesn't meet their threshold. And so they decline the referral. So families are in a very tough state because they're trying to find out, like you said, who does my child need to see to help solve these problems? And we need a different approach. I 100% agree with you. We need a different approach in which we're supporting and approaching a post-diagnosis support for children with ADHD.
Absolutely, we do.
Good. And coming to your coaching approach, do you want to talk a bit more about that to the audience so that they can actually see what happens?
Yeah. So in our coaching approach, we have first and foremost taken a team approach that, in the intake, we ask the parents to upload report cards, psychoeducational evaluations, any background information that is relevant for that child, because we need to know, what has school been like? What is their physical health? What is their mental health? We're not treating their physical or mental health, but it's part of who that student is as a person. And we also talk in that intake about, what are the child's strengths? What are they good at, both at school and in life? And not just, oh, they're good at English and math, but They're good at advocating for themselves. They're a great writer. They are curious about science, right? Coaching is strengths based. So we want to know what's good about that child.
Mm-hmm.
After that intake at my practice, the student gets matched with a coach, and then the coach begins to meet with the student. And the first thing we do with that student is we do a strengths assessment to co-discover with that child what their strengths are. And we do this for every age student we work with. And it's a wonderful place to start, because if you think about our kids with ADHD or autism, they have often felt like they don't fit or they don't belong. Sometimes they are at an age where they've gotten a lot of negative feedback, right? Nobody has ever started working with them and said, let's take our first session and figure out what are all the great, wonderful things about you. I mean, that is a powerful experience for a child who has been put on detention, who has had zeros on missing assignments, who has gotten yelled at, had their phone taken away, whatever it might be. So that first session is all about identifying their strengths, identifying their values, identifying what they're good at. And then we do go on and we do an executive skills questionnaire with them to help them figure out, okay, actually, I'm good at starting things, but I'm terrible at finishing things. Or, you know what? I can't get started to save my life, but once I get started, it's like my brain kicks in and I can finish it, right? So we bring this self-awareness to the executive functioning skills so that the student can begin to accept that and to grow. And it's done in a non-judgmental, kids aren't being graded, right? Like, okay, you're this survey. What do you think? Do you agree with this? Do you see this pattern in your life? And then from there, we work with the student to set goals and achieve goals. And generally speaking, our students are working on 2 academic goals and 1 personal goal. And yes, of course, what we want to see is better grades, right? More homework completion, passing grades. But you know what we want to see most of all? We want to see that student reconnect with their confidence, their self-esteem. We want that student to have a home life that is not all about school management, right? And parents yelling about homework. And we want that student to feel like they belong at school, right? And so we use this term connected coaching because we want the student to connect to themselves again, to connect to their family, and to connect to school. And so many of the students we get, even the younger ones, even middle school students, feel like, oh, I'm just not good at school. I'm not good at this. I can't do it. And so we want to connect them with the idea that, you know what, you can, and let's work together to develop the skills and the strategies that you need.
That's interesting and really, really good approach, because I'm just thinking about so many children that have been in my clinic this week, and I'm saying, oh my God, this is what I could easily have said to this child or this parent, this is what your child needs, because really that is what their child needs. Some children attended clinic yesterday, and they were verbally saying, I hate school. Oh, I don't want to go back there. And I was trying to explore with them, why do you hate school? And so I don't want to be like this, that. And I just thought, oh my God, it's heartbreaking when you see a child of that age really voicing this negativity about the school space where they spend, a reasonable amount of hours in a day.
Well, and, I don't know that much about, the education systems in the different, countries where you've worked, but I know here the teachers themselves are such great human beings, right? But the training that teachers get is all behavioral. Like, here are the consequences of your behavior. And the assumption is always the behavior is voluntary. The child could control it. They could focus. They could try harder. They could sit still. And so everything's behavioral. And it doesn't take a skill building or really even necessarily a relational approach. And we've got to change that in our teacher training system so that teachers come to understand that these aren't bad behaviors. These are symptoms of ADHD. I think what parents feel most of all is relieved and hopeful. That's what parents say to me. I feel hopeful again. So what we do after every coaching session is we send a very lengthy coaching note so that parent knows exactly what's going on. It's not superficial. It's not no problems this week. It's not, make sure Danny gets his homework done. It's not that. It's these are the strengths I saw in Danny this week. This is the skill Danny is working on. This is his goal for the week. And these are the concerns I have. And so parents, many times for the first time, feel like they're truly looped into what's happening with their child, right? I mean, we don't get that kind of information after, a couple years of primary school, right? We don't know on that level what's going on. And when you have a child who has ADHD or autism, you do have reason to worry. You have reason to be concerned. And so getting this kind of detailed feedback and then knowing that we will approach you if we feel like, this is what we're seeing and it might be worth a conversation with the doctor, or this is what we're seeing. And, if you could pass on these concerns to the child's therapist, or this is what we're seeing. When is the next school meeting for this child? Could we join you? Right? I think parents feel supported and hopeful, but it's a big commitment. I mean, because more often than not, we're the ones taking the lead on bringing the team together, But here's the thing, it's worth it. And it's the only way it works, right? And when you have a child who does have all of that intellectual, academic potential, and the thing that's getting in the way are their self-regulation skills or their executive functioning, you want to help. Like, I want that kid to be able to, go to the technical high school they want to go to, or, to go to this college. And so to us, it's worth it. And I think the professionals who've gotten to know us over the last 17 years really value that we can bring data to them that informs their practice. I mean, think about your kids that you see in clinic. Wouldn't it be great if you could read, in between, let's say 3 months, in the United States, that's common. Every 3 months you would see your doctor for ADHD check-in. What if you could read 3 months of coaching notes and see how is that child doing? And it was sent over to you. It was part of the file. You could skim it. You could see things are good, things are not good here. I mean, wouldn't that be such helpful data to have? Yeah. So unlike a lot of executive functioning practices, I don't hire any recent college graduates. Where there are two assumptions we don't make at Russell Coaching. One, if you were a good student, you'll be a good coach. We don't believe that. People can have great executive functioning skills, but not be a great executive functioning coach. Second thing, you can have ADHD or autism and not necessarily know how to be a coach. So those two things are out the window at my practice. I hire people who have 8 to 10 years of experience working directly with students in the classroom, in guidance, in special ed, in social services. I want that hands-on, feet on the ground, thousands of students background to bring to my practice. And then I train people internally because, again, coaching is unlicensed and unregulated. And so I don't care if you have some certificate from somewhere, you're a certified coach. Certified means nothing. Certified means somebody was willing to sell you a few hours of training, right? Certification is meaningless. So we train internally so that we are internally consistent and up to speed on what is the science of ADHD, what is the science of autism, what is the science of how kids learn, right? And so is that perfect? No, that's not perfect. But, there's no degree in coaching, there's no licensure needed. And so we just, as a practice, I'm very fortunate to have found, we have 24 coaches at this point, and everyone is just kind of geeky and nerdy about these topics and they care. And a lot of the coaches come from an education background. But you know what they say to me? They say, I wish I could do this full time. I feel like I'm making a difference. I feel like this matters. This works. And I wish school worked, but school is just a system that doesn't work for these kids. And so I think that, training is important to us. So is hands-on practical experience. It's not enough if you are a good student, and it's not enough if you have ADHD or autism. Well, right. I mean, this is such an enormous concern in our culture right now because parents have gotten the message, be more involved, be more engaged. child, but we've gone in some ways too far with that and not far enough. I think that we have really changed parenting to where we value that social and emotional connection with our children. We value seeing our kids for who they are. That is great. Sometimes, though, in doing that, we have let go of one thing that Harvard University Study for Child Development has said continuously for the last few decades. High expectations are important. They are one of the 3 significant factors for kids becoming adults. And I worry a little bit about parents who just back down off having expectations of their neurodiverse kids. You have to measure it, right? And you have to time it. But we can't just say, well, my child is going to throw a tantrum or have a meltdown, or they can't do that. And we can't do it when they're 16, 17, 18, because all we're doing is creating even more of a gap between our students and their peers. I am in no way saying this is easy, right? Your child will not pack for camp the same way you would pack them for camp. Your child will not clean the kitchen the same way you would clean the kitchen. I'll tell you, my personal one, I like when I do my laundry to turn my socks the right side out. I like to separate the darks from the whites. That's how I trained my children to do laundry. You know how my children do laundry now? They take the basket, they turn it over into the washing machine, and they start the washing machine. And you know what? I have to let go of it. I want it done my way, but the clothes are getting reasonably clean and they're not wearing dirty clothes. And we have to come to terms with this as parents and sort of redirect a little bit how involved we are. I think this is an area where social media has allowed parents to connect with other parents who are then solving their teenagers and young people's problems. My child can't get an internship. He's going to be in New Jersey for the summer. Can anyone help him find an internship? My daughter has an opportunity to go to New York. Does anyone have any leads on an apartment? No, 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 no. High expectations and be the coach, be the consultant, but do not be the director. First and foremost, understand the science of ADHD and autism. Learn what is really happening in the brain and learn what scientists, medical scientists, neurologists know about that condition. Don't rely on asking people online, is this normal? Does your kid with autism also do this? Go and learn the science, your own self. Ask wise people questions. The second thing that I would say is learn, what does ADHD or autism mean for your child, right? We know that 2/3 of kids with ADHD have something else going on: anxiety, depression, autism, dyslexia, dysgraphia. So we can't just say kids with ADHD need this, because we've got to differentiate between kids with ADHD and anxiety, kids with ADHD and learning differences, and kids with ADHD and autism, right? And so don't oversimplify ADHD down to, I stopped going on podcasts when people would ask me to come on and, can you do 10 tricks for better management of your ADHD kid? No, I'm not going to do that, because it's not consistent with what we know is needed, which is science and relationship and connection and the right school environment. I'm not going to do tips and tricks. That's not going to help. So, and then the thing I would say to parents is get a team, right? And get a team that you're going to feel good about, because this is hard. This is really hard stuff. And when you feel sad and discouraged and angry and resentful, those are normal feelings to have when you are a parent, first and foremost. But then when you are parenting a child with ADHD or autism who can be very resistant to requests, who can melt down, who can have intense emotions, it is hard. And find a team that can help support not just your child, but you also. It's been an honor to talk with you. It's so lovely to find someone who is passionate and knowledgeable and caring. And I will come back as often as I can be helpful to you. Thank you.
As we always say, early intervention leads to better outcome, and early intervention can only be achieved by early diagnosis. So thank you for listening into the series today. I know some of the things we've talked about today would probably have generated some questions or need to seek clarification. So I'm happy to take questions, and I'll invite you to send your questions to eim@drtakon.com. Thank you for listening in.